Perfume has been a part of human culture for centuries, adding a touch of luxury, personality, and confidence to our daily lives. However, as we age, our bodies change in ways we may not even realize, and something as seemingly harmless as fragrance can have unexpected consequences. For seniors age 60 and above, wearing perfume might pose health risks that many don't consider. From respiratory irritation to skin sensitivities, the impact of perfume on an aging body is more significant than you might think. In this video, we'll explore why perfumes can be harmful for seniors, how they affect the body, and what alternatives might be safer. Stay with us to learn some surprising facts that could change the way you think about your favorite scent. One of the most significant concerns surrounding perfume use among seniors is its effect on respiratory health. As the body ages, lung function naturally declines, making it more difficult to filter out irritants and recover from exposure to airborne pollutants. Perfumes contain volatile organic compounds, VOCs, which are chemicals that easily evaporate into the air and are then inhaled. While these compounds contribute to the longevity and intensity of a fragrance, they can also irritate the respiratory system, particularly in individuals with pre-existing conditions such as asthma, chronic bronchitis, or chronic obstructive pulmonary disease, COPD. Inhaling perfume particles can lead to shortness of breath, wheezing, coughing, or even a sensation of tightness in the chest. For those who have never experienced respiratory issues before, prolonged exposure to strong fragrances can still trigger new sensitivities, making it harder to breathe comfortably in enclosed spaces where perfumes are heavily used. Apart from respiratory effects, perfume can have a considerable impact on skin health, which is another area that undergoes significant changes with age. The skin loses moisture and elasticity over time, making it more prone to dryness, irritation, and sensitivity. Many perfumes contain high concentrations of alcohol, synthetic fragrances, and preservatives that can strip the skin of its natural oils, leading to redness, itching, or even peeling. Seniors with delicate or thinning skin are particularly vulnerable to developing contact dermatitis, a condition in which the skin becomes inflamed and develops rashes upon exposure to irritants. This reaction can occur not only from applying perfume directly to the skin, but also from wearing clothing that has been sprayed with fragrance. Unlike younger individuals whose skin barriers can repair themselves more quickly, older adults may experience prolonged irritation, requiring medical intervention or changes in personal care routines to prevent recurring symptoms. Another critical yet often overlooked concern is the potential hormonal impact of perfumes. Many commercial fragrances contain chemicals known as endocrine disruptors, which interfere with the body's hormonal balance. These compounds, including phthalates and parabens, have been linked to disruptions in estrogen and testosterone levels, potentially worsening symptoms associated with aging. For postmenopausal women, fluctuating hormone levels can already lead to mood swings, hot flashes, fatigue, and sleep disturbances, and exposure to synthetic fragrance ingredients may exacerbate these issues. Similarly, men experiencing natural declines in testosterone levels may be more susceptible to the effects of hormone-altering chemicals, which can contribute to changes in metabolism, energy levels, and overall well-being. Studies have even suggested that long-term exposure to endocrine disruptors may increase the risk of hormone-related cancers, making it crucial for seniors to be aware of what they are applying to their bodies daily. Beyond the physical effects, perfumes can also have neurological implications that impact cognitive function and mental clarity. The sense of smell is directly connected to the brain, influencing emotions, memory, and even behavior. However, exposure to strong synthetic fragrances has been shown to trigger headaches, dizziness, and nausea in individuals who are sensitive to strong scents. For seniors who already experience migraines or chronic headaches, wearing perfume or being around others who use it heavily can worsen symptoms, leading to discomfort that lasts for hours or even days. Additionally, for those experiencing cognitive decline, including early signs of dementia or Alzheimer's disease, exposure to certain chemicals in fragrances may contribute to confusion, agitation, or sensory overload. Some research has even suggested that neurotoxic compounds found in perfumes may interfere with brain function over time, affecting concentration, focus, and memory recall. While the full extent of these effects is still being studied, many neurologists advise patients with cognitive conditions to limit their exposure to strong fragrances in order to maintain mental clarity. The emotional and psychological impact of perfumes is another factor to consider, as scents can trigger memories and emotions in both positive and negative ways. While fragrance can evoke pleasant recollections of cherished moments, it can also bring up past trauma or stressful experiences. As people age, their emotional responses to smells may change, and what once felt comforting might suddenly feel overwhelming or irritating. In shared living spaces such as retirement homes or assisted living facilities, conflicts can arise when individuals have different tolerances for scents. Some seniors may find that certain perfumes cause anxiety, irritability, or even panic attacks, particularly if they are already dealing with high levels of stress or depression. In cases where fragrance is used excessively in public spaces, the discomfort can become unavoidable, leading to social withdrawal or avoidance of certain environments altogether. Perfumes can also pose risks for seniors taking multiple medications, as drug interactions can influence how the body reacts to fragrance exposure. Many medications, including those for high blood pressure, diabetes, and mental health conditions, can increase sensitivity to chemicals in perfumes. Certain drugs can make the skin more prone to allergic reactions, while others may heighten the effects of inhaled irritants, making it more difficult for the body to detoxify airborne pollutants. In some cases, seniors may experience unexplained symptoms such as dizziness, heart palpitations, or nausea, not realizing that their perfume use is interacting with their medications in an unexpected way. Doctors often recommend switching to fragrance-free personal care products to minimize the risk of unwanted side effects, but many people continue using perfumes without considering their potential impact. Another aspect to consider is the effect of perfumes on indoor air quality, especially in enclosed spaces where ventilation is limited. Unlike younger individuals who spend more time outdoors or in well-ventilated areas, seniors often spend extended periods indoors, where fragrance particles can linger in the air and accumulate over time. This can lead to constant low-level exposure to synthetic chemicals, contributing to symptoms such as chronic fatigue, brain fog, and respiratory discomfort. In settings like nursing homes, hospitals, and even private residences, strong fragrances can become a source of irritation for both the wearer and those around them. Some healthcare facilities have even implemented fragrance-free policies to reduce health risks for patients with respiratory conditions, allergies, or chemical sensitivities. For seniors who still enjoy wearing fragrance but want to avoid potential risks, there are several safer alternatives to consider. One option is switching to natural scents derived from essential oils, which are free from synthetic additives and harsh chemicals. However, even essential oils should be used with caution, as some can still cause skin irritation or allergic reactions in sensitive individuals. Opting for unscented or lightly fragranced personal care products, such as lotions, soaps, and shampoos, can also help maintain a fresh and pleasant scent without exposing the body to harmful chemicals. Another approach is to apply fragrance in a way that reduces direct skin contact, such as lightly misting clothing or using solid perfumes that contain fewer volatile compounds. The key to maintaining health and well-being while still enjoying pleasant scents is being mindful of how perfumes affect the body. Aging comes with unique challenges, and understanding how something as simple as fragrance can influence overall health can help seniors make informed choices about their personal care routines. Recognizing signs of fragrance sensitivity, such as sudden skin irritation, respiratory discomfort, headaches, or mood changes, can be the first step in determining whether it's time to make a change. While perfumes have long been associated with beauty and self-expression, the reality is that they may not be suitable for everyone, particularly as the body's tolerance to certain chemicals declines with age. By making small adjustments, such as choosing fragrance-free products or opting for more natural alternatives, seniors can continue to feel fresh and confident without putting their health at risk. If you found this information helpful, don't forget to like this video and subscribe to our channel for more insights on health, wellness, and lifestyle tips for seniors. Hit the notification bell so you never miss an update, and let us know in the comments if you've ever experienced sensitivity to perfumes. We'd love to hear your thoughts.